Table, yes, in the audience and virtually, fellow Lions, good evening. We are happy to see you all here this evening, and I wish to extend a warm Lions welcome to you all. I will do a little housekeeping before I go any further. To my left, your right, we have the restrooms. And to my left also, you have the pink table, the Lions pink table, where you can purchase items and register for our virtual walk run, which takes place the 29th to the 31st of October. At the back, we have Doctors Hospital, Cayman First, Alliance to End Domestic Violence, and Breast Cancer Foundation. Please visit these tables if you have not done so already. And just a note to let you know that any funds raised here, all of the proceeds go towards paying for the mammograms that we are giving you free. I will open with a word of prayer at this time. Let's bow our heads. Dear Lord and Heavenly Father, we come before you this evening with thankful hearts. Amidst all that we are going through, we have much to give thanks for. You continue to provide for us and shelter us as only you can. We thank you, Father, for this opportunity to host this breast cancer awareness meeting and your purpose for it. We thank you for each person present here and ask that you will guide and protect us. We pray that all that we have set out to accomplish will be achieved here tonight. Lord, take what we have prepared and multiply our efforts as only you can. We ask your blessing now on everyone here tonight. Blanket us with your peace. Keep us physically safe and guard our hearts and minds. In Jesus' name we pray. Amen. Without further ado, I would like to introduce a couple of our major sponsors to just share a word. And we're going to start with Mr. Henry from JN Money. He's the country manager. Mr. Henry, please. Welcome. Let's welcome him, please.
Good evening, ladies and gentlemen. It's a pleasure to be here this evening, to be at another breast cancer awareness seminar. At Jane Money, we are committed to nation building through health, education, and community development. We pride our corporate social responsibility, and as such, we have always been support events that benefits the community. The Lions Club of Tropical Gardens, we have been partnering with them over the years. And if I could share a short story with you. A few years ago, I'm not sure, it's so long I don't even remember when, the executive of the Lions Club of Tropical Gardens, they visited with us and they shared with us their plans for Breast Cancer Awareness Month. And the meeting, it didn't last long, maybe about 15 to 20 minutes. But at the end of it, we were compelled to support this worthy cause. And since then, we have been committed to this partnership, and we think that it has worked well. When they shared it with us, we saw the value of it, how it benefits the community, and it fits perfectly in our mantra. So we have been there, standing with the club over the years. The The thing that we took away from this was that cancer is real, and the assiduous effort that they took in bringing awareness to the community. We know that a lot of persons are impacted by cancer. It has taken the lives of our families, our friends, and our loved ones. So it was something that was dear to us, and we were just compelled to support it. And years later, here we are, still in this partnership. As a matter of fact, it can be argued that this partnership has grown into a marriage. And I want to say to the Lions Club of Tropical Gardens, Jane Money, we are honored to be a part of this marriage. And as long as this month of activities remain relevant to the community, it is supported by the community, then you have our unwavering support. To all of us in the audience this evening, I trust that we will ask all the burning questions. We will look at the gray areas. We will take full advantage of the opportunity created to us. And we will also leverage Dr. Awasthi, who is here with us, leverage his expertise. And at the end of the night, we will leave here a more informed group. Thank you.
Thank you, Mr. Henry. Protocol must be observed, right? At this time, we are going to ask Ashley Lund, a volunteer at the Breast Cancer Foundation, to come and say a few words on behalf of the foundation.
Thank you so much. Good evening, everyone. It's a pleasure to be here and a true honor to continue the great work that the Lions Club and the Cancer Society have been doing for so many years here in Cayman. The partnership has been really long, and over these years, we've together been able to figure out things that we can do to make sure we're getting the information out to people and we're getting the help that people need. The Breast Cancer Foundation, as you may know, deals more specifically, I should say, with breast cancer. It's a daunting thing. We do have a lot of people in Cayman that have suffered through breast cancer, but we have a lot more survivors. It is a cancer that you should not die from if you can detect it early enough and if you can do the right things. We have incredible resources here in Cayman. We're so proud of how far this island has come with the developments and the research and the chemotherapy and the treatments, the information, the assistance, and the support. So please reach out if you have questions. We are here for you. The resources at our fingertips are very, very great, and we're really proud of that. All of these organizations here work together to get the job done to make sure we're helping our community. So Cayman first all the way, and we're so proud to be with these guys and a part of this, and we'll always be here for you. So don't forget us. We're right over there. Lots of info for you. Thanks for being here.
Thank you, Ms. Lund. At this time, we are going to have some remarks from our president, Lion Maxine Bravo and Melvin Jones Fellow.
Good night, everyone. What I'm seeing is beauty. Tonight you look really well. I've not seen anyone here who is impacted by COVID, right? I am happy that you're out tonight to be here at our final meeting for the campaign. And I'm hoping that our panelists will entertain you, inform you, and educate you. And you know, the person who is smiling, of course, is none other than our survivor, our very dear survivor, Miss Amica Scott. Tonight, I'm pleased to announce that after months of planning and a month-long campaign, We have come to the last breast cancer awareness meeting, and despite COVID, we continue to meet the needs of the community. I want to thank my Lions family. Give them a round of applause, please. Our supporters, our volunteers, our sponsors, and those persons who are just there with us. Their efforts, as we have again exceeded our reach, but remain committed. They have remained committed with us just to serve you. Yes, we made it through 25 years, and we do hope to continue another 25 years in service to you, to assist the women of the Cayman Islands with charity mammogram vouchers. Let's put our hands together again for our panels. We have Ms. Jennifer Weber, Ms. Amica Scott, Dr. Aswathy, and Kira Matthews, who will now present to you. Thank you very much. Let us start a successful meeting.
No. Okay. At this time, I'm going to ask Lion Norma Matfield, Progressive Melvin Jones Fellow, to come and introduce the panel members.
Good evening, members of the audience and our esteemed panel. I am here to introduce you officially to our panelists this evening. We have our moderator, who's Jennifer Weber, panelist Dr. Sanjay Aswathy, breast cancer survivor Ms. Amica Scott, and an insurance representative, Ms. Kira Matthews. Ms. Jennifer Weber is the operations manager of the Cayman Islands Cancer Society, where she has worked for over 10 years. Jen, as most people know her, is a true-to-heart caring person and is also very knowledgeable about health insurance and has helped many women navigate the health insurance landscape. Jen, who's also fluent in Japanese, is a caring and charismatic person who represents a society that continues to partner and promote the Lions Club of Tropical Gardens Breast Cancer Awareness Month annually. The doctor on our panel this evening is Dr. Sanjay Aswathy. He's an oncologist with Doctors Hospital, and he's been practicing for more than 20 years. He received his medical degree from the University of Texas Southwestern Medical School, where he later worked as the Division Chief of Hematology and Oncology in the Department of Internal Medicine. Dr. Aswathy is trained to diagnose and treat all types and forms of cancer and employs various diagnostic tests such as biopsies, imaging tests, endoscopic tests, and laboratory tests. He's also trained to offer treatment techniques such as chemotherapy or radiotherapy, combat the spread of cancer. And Ms. Amica Scott is our 12-year breast cancer survivor. She's a member of the support staff in the Department of Education. She is a 12-year survivor. However, amidst the COVID pandemic last August, she learned that her cancer had returned and she underwent surgery in September. But praise God, she's alive and well, and she's here with us today. And finally, our third panelist is Ms. Kira Matthews. She's a customer care manager. Kira joined Cayman First Insurance on June 1st, 2000 as the receptionist and has worked her way through the organization. For 15 years, she served as the assistant operations manager in the group insurance services unit and was promoted to customer care manager on January 1st, 2020. And without further ado, I'll now turn it over to Ms. Jennifer Weber, our moderator. Jennifer.
Well, good evening, everyone. Thank you so much for coming. I know with COVID, sometimes people are nervous to leave the house, but this is really important information. And the Lions Club has done such a great job again this year to make sure that all the information gets out to the people, and the people who need to get mammograms can come, get the information, and get their mammogram tests as needed. So let's give one more round of applause for the Lions Club of Tropical Gardens who brought us all here together tonight. Okay, so we're doing things a little bit differently tonight than has been done in the past. We have 3 panelists here, and we're going to start by just asking questions and instead of doing traditional format of presentations, we're going to start with Dr. Sanjay Aswathy. Now, you might notice that I called him Dr. Sanjay. Some people call him Dr. Sanjay. Some people call him Dr. Awasthi. Dr. Sanjay is his first name. Awasthi is his family name. Do you have a preference yet about what you're going by?
I'm good with either. Sanjay is much easier, but if you can call me Dr. Awasthi as well. It's just like it's spelled. You have to look at it, but Sanjay is much easier.
Okay, so Dr. Sanjay is okay. So I think we'll start tonight with Dr. Sanjay, and we'll just kind of start with the basics, and we'll talk and we'll ask some questions to Dr. Sanjay to begin with, and then we'll move on to questions to Ms. Kira about insurance and all these good things like wellness benefits and where you get your mammogram and when it's covered and when it isn't and when you can get your pap test. And then we'll talk to Ms. Amica to find out how she's always so amazing no matter what comes her way. So Dr. Awasthi, let's start with you. And let's start from the very beginning. Tell us, what is cancer? And specifically, what is breast cancer?
So our body is composed of billions of cells, and they're programmed, they were made that way to perform a particular function. They grow when you're young, and as you get older, most of these cells stop growing. Unfortunately, for a variety of reasons, factors having to do with heredity or the environment, or just, I guess that we would say acts of God, that some of these cells become abnormal and they grow without any control. And a cell is so small you can't see it. 1 billion cells is barely enough to see, 1/4 inch in size. And as they become larger and larger, they cause pain, they cause bleeding, they block different tubes and so forth in our body, and they cause most commonly symptoms like weight loss, symptoms of fatigue, symptoms of pain, bleeding, and many other changes in the health that are specific for each cancer. And if you're aware of them, then we can now cure a very large percentage of cancer, particularly breast cancer. So breast cancer starts in the breast. It starts in the tubes that make milk. So these tubes are connected to little sacs which make milk, and the milk comes out through the nipple. And the cells within it are, they're there for many, many years. They are recycled when you have children and you breastfeed. But after a while, that they are just sitting there and they develop what we call mutations. The mutations are changes in the alphabet of all of your genes. So we have tens of billions of these little alphabet letters in the gene, and change in one of them is sufficient to cause cancer. There 10, 20, 30, hundreds of these changes occur in different kinds of cancer. Breast cancer occurs because these cells become sensitive to estrogen. So they start using estrogen to grow. Estrogen is the women's main hormone. So that is what cancer and breast cancer is. I hope I answered that.
Okay. Doctor, are there things that we can do that are a direct cause and effect that will give us cancer? For example, I have heard people say, "Oh, if I use deodorant, it will give me breast cancer. If I wear an underwire bra, it will give me breast cancer. If I have some sort of trauma, like if I'm in a car accident and the seatbelt it gives me some trauma on my breast, do those things automatically cause and effect, give you cancer?
The short answer is no, but an explanation is necessary. One of the reasons why we don't tell you to put deodorant, we tell you not to put the deodorant in the armpit when you get your mammogram, is that little particles of the deodorant show up on the x-rays of the mammogram, so we tell you not to use it at that time. What was the second one?
If you have a car accident and the seatbelt.
Yeah, so trauma or injury to the breast, any injury can cause a scar. And any scar can eventually, not in a few days, but decades, can give rise to certain types of cancers. But scars do not give rise to the type of cancer that is breast cancer. Those are usually cancers of the muscle or the bone that occur from scars. And certainly, so to the first question, or first part, is what can you do to prevent it, because what do you want to know about what causes it? So the vast majority of all cancers in this world are caused by smoking. Breast cancer is affected by smoking, not certainly as much as lung cancer, but cancers of the breast, the colon, the pancreas, the bladder, the kidney, and virtually all cancers are related to that. Excessive alcohol use is another risk factor or contributor to cancer. Lack of exercise weakens the immune system, and our immune system is sufficient to probably pretty easily kill 100 million or 1 billion cells that are forming as a cancer that you don't even detect. And exercise gives you certain chemicals like endorphins and other chemicals that can prevent breast cancer. Diet is important because certainly there are certain foods that contain chemicals that can promote mutations. So generally fresh foods don't tend to do that. Foods that have rotten, when they become rancid, the chemicals that you smell in that rancidity are normally produced in our body. And over the period of the decades of your life, those chemicals also cause mutation. And why do they increase? Well, they increase if you eat too much. They increase if you eat too much sugar or carbohydrates. They increase because you have certain habits that I mentioned. They increase if you take hormones like estrogen, if you take them for very long periods of time. Short periods may not increase that risk. These are medications that provide benefit to women, but there is a small chance of that. Importantly, cancer is run in families. That is, some of these things we call mutations are actually present in all of us already when we're born, and they will be passed on. And these are the signature of you. Everyone has these signatures, and some of those signatures predispose you to get cancer. So knowing your family is important, because if you know that your grandmother's sister, her son, her daughter, the people that are dear to you, your relatives, if they've had cancer, and if you find out that many have had cancer, some of them at a very young age, then you start suspecting that maybe that I'm at high risk. So yes, injuries can cause cancer, but not generally breast cancer. But one thing does happen. It brings you the attention. That is, when you get injured, the lump that's in the breast already is noticeable now. Okay, so it is not a cause and effect relationship.
Okay, could I ask you just to talk a little bit more about what you said about sugar? I have heard people say sugar gives you cancer. Is it that sugar gives you cancer?
Sugar doesn't give you cancer. What happens is that, well, I shouldn't say that. Let's put it this way. Okay, the sugar is burned in the body. We love sugar because it's good for us. Carbohydrates and limited amounts provide us with immediate energy. They provide us with pleasure. They provide us with happiness, and they're an essential part of the diet. Too many calories most often includes too many carbohydrates. And there's a difference between a complex carbohydrate and a simple carbohydrate. Sugar is the simplest form. It gives you immediate energy. And what it does is it makes the engine of the cancer cell turn faster. And it generates these chemicals which generate other chemicals that cause mutations. So the best example I can give you why sugar is important is how many, raise your hands, have heard of a PET scan?
Mm-hmm.
Okay. So the PET scan, the way it works is it measures how much sugar is being eaten by a piece of tissue. And if the amount of sugar that it's taking up is greater than a certain amount, then more than likely it is either cancer or inflammation. And the brighter it gets, the more likely it is that it's cancer. That is, that the cancer may form from many different things. That is, when it begins, but sugar can make it grow because cancers use sugar primarily to feed on.
So, doctor, you also mentioned your family history is an important risk factor. So, if my mother had breast cancer and my grandmother had breast cancer, should I give up hope and assume that I'm going to have breast cancer and just live my life? Or are there things I can do to reduce my risk?
Hope is something that, by definition, should never be given up. Nothing is definite in this life. Those people that have every member of their family affected with cancer may themselves escape it. Okay, so that there are things that are beyond us, and the most that we can do is pay attention to that fact. That is, my mother had cancer, her sister had cancer, my sister had cancer. Okay, that starts to tell you that around the same age, so you ask, how old was your mother? Well, if she was 90 at the time she got breast cancer, it's less likely that you're just going to get cancer until you get that age. But if she died at the age of 30 or 40 of breast cancer, and your sister had breast cancer at the same time, and your brother had prostate cancer, or your young nephew had leukemia, or your young niece had a brain tumor, these are the warning signs for doctors to say that there is something that is underlying, not necessarily that we have to do tests. I mean, this is Awareness Month, Breast Cancer Awareness Month, which means that you have to be aware that that increases your risk. You have to be aware that when you smoke, you're increasing your risk. You have to be aware that if you have no children at all and no pregnancy, your risk is higher. You have to be aware that if you've never breastfed, your risk is higher. These are things that sometimes doctors forget to tell patients until until it's too late and they already have cancer. So, maybe you should just go forth and multiply and reduce the amount of breast cancer. But I won't give that as a formal recommendation.
Okay, so doctor, let's say, what happens if I am diagnosed with cancer? What happens next?
So if you're diagnosed with breast cancer and you were prudent enough to realize that you had these risk factors and by the age of 40 if you had very high risk factors. By the age of 50, just because you're old enough now, you get a mammogram. You may get diagnosis on the basis of that. The radiologists are more than 90% correct when they say something is, this looks like cancerous. Other times you get a lump in your breast. So either one of those is followed by an ultrasound test usually to see how big this is. Does it look just like a fluid pocket? Because sometimes the mammogram can't tell that. That is followed by a biopsy, and what a biopsy is usually a needle that they insert into the breast after they numb it up. It's not completely uncomfortable. I mean, it's not completely painless, but it's very short, and the needle has a whole core in it, and the core brings back a very small amount of tissue that pathologists can look under the microscope, and they can say, yes, it is breast cancer. Yes, it is a certain type of breast cancer. Most of those breast cancers are actually of the type that respond to hormone, that is, they're sensitive to estrogen. That makes a big difference because many of those women will never need chemotherapy. They may just take a pill that reduces the chance of getting the cancer back, but that's later. The next step after knowing that there is a tumor is to define, is it elsewhere? So if it's large versus it's small, the risk is much higher that it's spread into your lungs, bone, brains, versus like this, where the only risk is maybe it's gone into the lymph nodes. So the doctor may do different types of tests to see where this might be, how much there is. Once you eliminate that it's right there and only there and pretty small, then a surgeon basically removes it. In the old days, they used to take the entire breast off, but in the early 80s and late 70s, there was a guy named Dr. Fisher who devoted his life really to saving breasts. And what he said is that the removal of the breast is not any better than taking a small amount of the tissue that's around the tumor and the tumor out, but you have to follow it with radiation treatment, basically once a day for 5 minutes for about 6 weeks, or maybe as short as 4 weeks now. And that basically sterilizes those cells, a few cells that may be left behind when a surgeon cuts. Now, if your tumor is big, larger than, let's say, an inch, then you still want to preserve your breast, but unfortunately, the best way of doing that is to give some treatment. Most commonly, it is chemotherapy, but sometimes it can be non-chemotherapy pills that you can take to shrink the cancer so that the surgeon can do a simpler surgery, so even the smaller breasts can be preserved. If it goes into the lymph nodes, it's considered the third stage. The first 2 stages are 1 and 2, small versus large. When it's in the lymph node, it's the third stage, and there it's very important for most women to take some chemotherapy, and those women in whom the cancer goes away completely with chemotherapy, that you may be able to still preserve your breast, but it's more likely that you're going to end up needing radiation even if they remove the breast, because there's a high risk that it may come back in your armpit. And then, of course, you could be unfortunate enough to get diagnosed with the 4th stage of cancer, where it has spread outside of the breast or the lymph node. That is not a death sentence. I've taken care of women. I've probably treated over 2,000 women with breast cancer over the past 30 years. And I've seen them live for 10 years, 20 years. And some of them I've seen them live for only 6 months. Now it's much more common now that people will live 5 years with the treatment. So those are the things that happen when you're diagnosed. And important thing there is that you have resources here. You have amazing resources on this island that I would have never believed. okay? You have the Cancer Society, the Breast Cancer Foundation, the Lions Club. You have so many resources to say, hey, beyond just your family, beyond just the doctor, beyond the social workers and others you can be put in touch with, that's what you do. You've got a lump, you got to talk to some people. But don't take advice from people who know nothing. You take advice from someone that's been treated for breast cancer, someone that knows, someone that survived. Because getting advice from the third cousin of the husband of, cousin 4 times removed and about to be 5 times removed, is not the right way. And Dr. Google is not always right. So if you have to look at nci.gov. That is a United States website that has the most reliable information. The American Cancer Society has the most reliable information. And unfortunately, we don't know how much cancer is on this island. We have a perception that it's everywhere. But there's the efforts to count it are just beginning. And they need to become more expansive, so we have registries of how many cancers there are, so these foundations can decide how much of their resources that they can devote to this.
Did you all catch that? That Dr. Awasthi is talking about what in Cayman we call as the Cancer Registry. So the Cancer Registry has been around for a number of years, 6 years or so, maybe 7 now. But in this country, we have what's called a voluntary cancer registry, which means that survivors like Miss Amica have to come forward and say, I want to be registered. So she has to speak directly to the cancer registrar. In other countries like Jamaica, they've had a cancer registry, a mandatory automatic cancer registry for more than 60 years. In the United States, it's automatic. But in Cayman, it is voluntary. So for now, the only people who are included in the registry are people who themselves come forward and say, I would like to be registered. So if you know anyone who is a cancer survivor, please encourage them to come forward to get registered. It is an anonymous process, and you cannot assume that because you got treatment in Cayman, that they probably have your information. They don't. Many times I have people come to me at the Cancer Society and say, you have all my information, just give it to her. I cannot do that. It has to go directly from the patient to the cancer registrar. And if you're thinking, oh, I don't know if I'm registered or not, Amanda, the cancer registrar, is the opposite of me. She is tall, thin, blonde, and blue-eyed. So if you have not met privately with Amanda, you are not registered. So please keep that in mind. If you need to find out how to get registered, I'm sure you can talk to the Lions Club. I'm sure you can call the Cancer Society, and we can make sure that you're in touch with them.
And even beyond this, when you have a formal registry that they have in almost all major countries, what they do is they actually record the size of the tumor, the type of the tumor, where it went, what it was treated with, and once they get these thousands of cases together, they can tell you that this particular neighborhood has a high risk for cancer. And that information is essential to go to your legislature and parliament and say that, that there is a high rate. Because remember, this is paradise. Cayman is as close to paradise as there is. You have lots of sunshine, therefore lots of vitamin D, so you shouldn't be getting as much breast cancer. You have a fish diet, you have a vegetable diet, so you shouldn't be getting so much breast cancer. But we don't know. In fact, the Aruba has a registry. They know exactly, and they know how much money is being spent by the government for cancer. If you don't know how much cancer there is, it is not a matter of loss of privacy. It is really a matter of community, and it is a matter of sacrifice.
Just to add a little bit of information to that statement, Just today, ran some totals, and did you know that in the last 5 years, the Cayman Islands Cancer Society has provided nearly $1.5 million in financial aid to breast cancer patients. So that's 1,499,000 and change. The reason I say that is because everybody feels like, oh, we have so much cancer. We don't know if we do or we don't. We all know people who have cancer, and people say, well, we must have more breast cancer because everybody has so much cancer. But think about it, the Lions Club of Tropical Gardens were the original organization that were promoting education and awareness about breast cancer in the community and providing mammograms. So when they started doing that, you know what happened? They started catching some cancers. And the more you look for something, the more you find it. So it makes sense that we have lots of breast cancer patients because it's being detected because of organizations like this who are doing such a great job for 20 years, more than 20 years now. But we don't know exactly how much we have, so that cancer registry is so important. So Dr. Awasthi, I'm going to ask you one more question, and then Ms. Kira, clear your throat because I'm coming for you next. So what is new in breast cancer and cancer detection? Is there anything like a blood test? People ask me all the time, can I just go to the hospital and get a blood test and see if I have cancer?
Okay, so the newest thing in breast cancer that a lot of people are not aware of is the death rate of breast cancer since 2011 has fallen dramatically. And the reason for it is we're diagnosing it early. The normal breast cancer, the normal blood test that your doctor does is unlikely to specifically diagnose breast cancer, although there are some available tests that once you know you have breast cancer, you can use that blood test to know how much there is during treatment. When someone gives you chemotherapy, the number drops in half. In the very near future, we will have a test or tests where we take a small amount of your blood and use a machine, the same type of machine that they're using to measure whether you have COVID infection or not. But we can do it on the blood, and we would be able to tell you whether you already have it or whether you're at a risk for it. It's at least 5, perhaps 10 years away, but that's within the lifetime of most people that I see here.
That's great news.
The other thing is that there are many things beyond chemotherapy that have been invented. There are many, many kinds of pills that can be given for breast cancer that work through hormones, or they're called targeted medicines. They're basically like guided missiles. You take a pill, the pill knows where to go. It kills only the breast cancer and doesn't make your hair fall out and doesn't do the other things that chemotherapy does. There are immunotherapies which don't quite work as well for breast cancer yet, but they do work for certain types of what are called triple negative breast cancer, which is more common in people with African ancestry, and a very bad kind. So there is a lot of hope in terms of treatment, but the essential thing still is early detection, because you get to save your breasts, and that technology is here. There are now ways of imaging the breast so that it's almost as good as a CAT scan of the breast. There are technologies now on island that don't require squeezing the breast. They're essentially pain-free. Nothing is discomfort-free, but certainly nothing like what we had even 10 years ago. And those technologies have gotten better with artificial intelligence, so that you can have computers be able to tell whether a breast has cancer in it. So those are the new things that have happened over the past couple of decades.
So ladies, I would encourage you to think about any questions that you might have, because at the end, when we do a wrap up, we'll have a chance to ask Dr. Awasthi questions. But for now, I'd like to switch gears and ask Ms. Kira to talk to us about insurance. And we got to give her a big round of applause, because, you know, the insurance companies they get yelled at a lot. People get upset with insurance companies when they don't pay. They love them when they do pay. And I really appreciate that Ms. Kira took the time to come out today to talk with everybody, because the information that she's going to provide is going to make it so that we can all better utilize the benefits that we have. Because if you understand what you have, then you can use it. So, Ms. Kira, would you like me to ask you questions, or would you like to just start talking? Okay, so take it away.
All right, so first of all, I would like to say thank you for allowing me the opportunity to come here tonight to talk to you about health insurance benefits. It all starts with your enrollment form. When you fill out your form, we ask that you disclose everything that is asked of you. Do not leave anything unanswered, because you don't want it to be a situation of claims being denied due to non-disclosures. With the health insurance, there's a plan called the SHIC plan, the Standard Health Insurance Contract, which is offered by all of the health insurance companies, whether you're on a group plan or an individual plan. So the maximum lifetime benefit on this plan is set at $1 million. And then the maximum calendar year benefit is $100,000. And when we say calendar year benefit, we're talking from January 1st to December 31st, and then your benefits would refresh on January 1st again. With the SHIC plan, there's no deductible set in place. The benefits that are most utilized under most health insurance plans are the office visits, the diagnostics, pharmacy benefits, and wellness benefits. So on the SHIC plan, the diagnostics, physiotherapy, and prescription drugs, and the office visits, they're all joined together under one benefit set at $400. For the diagnostics, it includes lab tests, x-rays, and any testing for lumps when you do your mammogram. So you can utilize any of those benefits within the $200. Then we go on to wellness. The wellness benefit is set at $200 under the basic plan. So the wellness includes anything from your routine screenings for the mammogram, pap smears, and the PSA testing. So you can utilize that $200 for any of those benefits. When it comes to a situation where breast cancer is concerned and you've been diagnosed, there is coverage for chemotherapy, radiotherapy, and even hospitalization. So you would first be required to satisfy the out-of-pocket maximum, which is $1,000. So once that has been satisfied, then your benefits would be covered at 100% up to the calendar year maximum of the $100,000. If at any event where you need to have emergency treatment, so emergency is classified as threat to life or limb, so it would be covered at 100% up to $4,000. Now, that there is with the basic plan. So there will be persons that are on higher plans with other insurance companies. So to verify what your limits are, you should speak and liaise with your insurance company to determine what your limits are and how much is available to you. Another thing where on the higher plans, you would be subjected to deductibles. So when we say a deductible, that means that it's a portion that you would be responsible for. Let's say, for instance, $250 or even $500. So that would come out of your pocket first. And that's typically done where diagnostic testing is concerned on the higher plans. So you satisfy that first before the benefits are paid out at the 80-20, or if there's another agreement with your insurance company. But it's typically 80% versus a 20%. And one thing that should be noted where the 80% is concerned is that health insurance companies, they do pay based on the standard health insurance fees that are set in place by the government. So if your provider charges you anything above those fees, then you would be responsible for the differences there. If there's a situation where you may have to be, let's say you opt to go overseas and you make arrangements there, you should speak with your health insurance provider and they can make the arrangements and make the arrangements for you so that you have a smooth transition over to the overseas provider. In addition to that, what you should note is that any procedures that are high in level, let's say above $250, they should be pre-approved to avoid any claims being denied, right? So even with overseas providers, your claims or your benefits should be approved prior to. And last but not least, to ensure that, your claims are paid, we encourage you to ensure that your premiums are kept up to date, just so that there's no instances of denial of claims due to the premiums not being paid.
Okay, great, thank you. Okay, so I want to just do a quick recap, okay? So everyone who has a SHIC, I have to enunciate that very carefully, SHIC with a C at the end, the Standard Health Insurance Contract Plan, has $200 that they can use for wellness.
Correct.
Is that correct?
Correct.
Okay. And some people may have more, but the basic lowest plan by law is that everyone has a wellness benefit, a little wellness benefit, and inside that can, the insurance company puts $200, all right? So the person who has this insurance can use that $200 every year because they can use it every year, if I understand correctly, to get a mammogram or a pap test.
Correct.
Right? Okay, so because a mammogram and a pap test each cost about $200, and in the Cayman Islands, the guidelines for getting these tests are that you get your mammogram and your pap test every other year. So isn't it true that everybody who has a SHIC plan actually can use their wellness benefit to get a mammogram, let's say on even numbered years. You have two breasts, that's an easy way to remember. On even numbered years, 2020, 2022, 2024, you use your $200 to get your mammogram. And on odd numbered years, because there's one spot down here, right?
Right.
On odd numbered years, on 2021, 2023, 2025, you use that $200 to pay for your pap tests so that you can utilize your insurance to get the screenings that your doctor wants you to have to stay healthy.
Correct.
Everybody understand that? Isn't that good news? Aren't you happy to know that you do have insurance that will pay for this? Now, keep in mind that if something happens and you had a mammogram 2 years ago and, you had a mammogram a year ago and then you find something, that doesn't mean, oh, the insurance company said I should wait 2 years. If you find something, you go to the doctor and get it checked out. If you need help, you come to one of the organizations to help you with that. But if everything is going well, these are your screenings and they are paid for by your insurance. Now, Ms. Kira, I have to ask, if people don't use this benefit, will they lose it?
If they don't use it, yes, they would.
So if you are someone who is thinking, oh, I've had my insurance for 5 years, $200, $400, $600, $800, $1,000. I got $1,000 backed up in here.
No.
That's not true. You have to use it or lose it every year. So use these benefits to help yourself. The insurance company provides them to you. They're available to you. And if you use them, the insurance company won't go, oh, there goes Miss Amica again using her PAP voucher or getting her PAP test. We don't want to help her because she uses her insurance too much. It doesn't work that way. There's a contract, they will pay. So go ahead and let them pay. You pay for that benefit, use this benefit, okay? So that's an important part. And if there are no men in the room, next month when we're here, we're going to talk about how this same benefit for men pays for the PSA test, the prostate-specific antigen test. So ladies, keep that in mind as you talk to your husbands or your brothers or your friends. If they say, oh, my insurance won't pay for it, you can tell everybody, no, you have a wellness benefit and it'll pay for your PSA test. Okay, let's give a round of applause for Ms. Kira, who did a great job explaining how insurance works.
Thank you.
Are you ready, Miss Amica? Did you fall asleep waiting for your time? Okay, so next up we have the lovely Miss Amica, who is not only a one-time cancer survivor, but now a two-time cancer survivor. And so, Miss Amica, let's go ahead and let you tell a little bit about what happened to you, and then I'll ask your questions, okay?
Ladies and gentlemen, good night. You saved the best wine for the last, right? 2009, I was 58, young in my prime, but I noticed I was having discharge from my nipple and I went to the doctor. They ran all kind of tests. They said the ducts were black, blah, blah, blah. But it continues to give a bloody discharge now. And they run the test. And the surgeon called me and he said, I would like to talk to you. And I said, yes, this is it. And when I went in, I said, oh, it's cancer. He said, I've never seen anybody like you. I said, I know. I asked him, when can you remove the breast? He said, I make arrangement to do it the Friday of next week. But unfortunately, I did 12 rounds of chemo, going good. I'm in Cayman 32 years and I wear my hair so low, you couldn't know anything. Now they have the cold cap, thanks to Breast Cancer Foundation. Yeah. So I did the surgery and I did 12 rounds of chemo and I was going good. 13 years after Mr. COVID visit us, every year, you know, you have to went and get your mammogram after you're diagnosed with breast cancer. And when I went, the woman that was doing the ultrasound took long. And I said, oh, you take so long? She said, just 1 minute. I said, You turn the monitor off that thing, let me look on it. And when I look, I see a lovely white spot. I said, again? She said, well, Miss Amica, you have to do an ultrasound. I did the ultrasound. The result come back that it was cancer. Last year, August ending. And so I did the surgery in September. Can you imagine a 70-year-old woman, I forgot to take off another breast again? The first time I asked the surgeon, could you remove both breasts? He said no. So I requested that same surgeon to do the surgery. He said, Miss Amica, if I had just listened to you, but he did the surgery. So here I am, I'm back on my feet again, standing tall and strong. Yeah, that's me, you know me, Miss Strongman. Ask me a question now, Miss Jen.
Okay, I'm happy to ask you a question. So, Miss Amica, I wonder if you could go back in time and after all of your experiences through the last 12 years, if you could go back in time and give advice to Miss Amica at 58 years old when she was first diagnosed with breast cancer, what advice would you give her?
When I was first diagnosed, it was strange because mine is hereditary. Auntie, cousin, right down the line. So, you know. But my advice to you ladies, be strong, think positive, get all the support you can. I get a lot of Cayman Islands, everybody support me. Church, Lions Club, Breast Cancer Foundation. What's your name again?
Cancer Society.
Cancer Society. Friends, co-workers, everybody support Miss Amica. Relatives, I tell you the day when I was to do my surgery, my minister was there before me. So I thought he was the one doing the surgery. Yeah? Support have a lot to do. I talked about my cancer. Some people, when they're diagnosed, they doesn't talk about it. I'm open. I work at a school, and when the head was so bald and the kids were looking, I said, come here. I said, what are you looking at? She said, oh, not me, miss. I said, it's breast cancer. And I said, when you go home and you go in the bathroom, examine your breast. If you doesn't want to do it, ask your mom. That child came back to me and said, I asked my mom, and she said, get away from me. Yes, I'm open about it. Very open. All of you will know me open about my thing. I don't coop up with it. So support is vital. Go again, Miss Jen.
Miss Amica, I know you are always so positive and faith-filled, which is wonderful. There are a lot of people, though, who they get what they call scanxiety. So at the end of their treatment, when it's time for them to go for their checkup, right before their checkup, they start getting nervous. They have this anxiety because the cancer might be back and they're afraid what the doctor is going to say. How do you cope and make sure that you don't end up with scanxiety before you have your checkups?
No, I did not have that. I have my son. I have my survivor friend who always want to go with me. And, you know, I'm so blessed to have people around me who support me and want to go with me. So I was not scared. Even when I'm doing chemo, I walk in as if we're just going to the regular doctor, go find out what's happening. We lost a friend. Some of you here might have known him. Because a male, gentlemen, you listen, man can have breast cancer too. A male, and he was to do chemo. And he was so scared and he did not want to do the chemo. And that man died. The cancer spread. And he was the only male among us ladies. He was the king among us. And we lost him. So support have a vital role to play. If you, I know some of us are expats here, we doesn't have any family. But I guess your boss, you talk to them. They can support you. And go to the church and talk to the pastor. Somebody will come with you. Support does it all.
Yeah, she's awesome. While Ms. Amica mentioned these things, I wanted to make sure that everyone is aware that, you know, some women don't want to do their treatment because they're afraid that if their breast is removed, then everyone will be able to tell they had cancer. The Breast Cancer
Foundation will give you, look at me, these two gone, and look here.
Yes, the Breast Cancer Foundation can provide prosthetic breasts and special bras that have a nice pocket.
They even give you the one to go swimming.
That's right.
You're in the ocean, nobody knows.
So the Breast Cancer Foundation is working hard to make all the women three-dimensional, one breast at a time. And in addition, sometimes women say, oh, I don't want to do the chemo because my hair is going to fall out and I don't want to lose my hair. The Breast Cancer Foundation has wigs. If you need a wig, you can use the cold cap that they've provided, and if you need a wig because some of your hair fell out, you can get a wig from the Breast Cancer Foundation. So there are wonderful resources available to make sure that nothing prevents you from getting the life-saving cancer treatment that you need.
And it's free, ladies.
Yeah.
It's free.
Go ahead, give them a round of applause. Okay, so now we've heard from all three of our panelists. I wonder if anyone has any questions that they would like to ask the panelists. Yes. Looks like we have a microphone coming your way.
Good evening, everyone.
Good evening.
Good evening to the panel. To the doctor, you mentioned earlier about taking samples from the breast and get it tested. What I would like to know, if you could tell me, what are the different types of cancer that one can get?
Check. Okay, so her question is, what are the different types of cancer that a woman can get from the breast?
Try to speak again, Dr. Awasthi.
Okay, yes.
There we go.
So there are two major kinds of cancers that you can get from the breast. One is called a ductal, and one is called lobular. Ductal is about 85 or more %. Lobular is the rest. The difference is the ductal can be caught on mammogram more easily. The lobular may be missed on a mammogram, but if you still feel a lump, then you need to go back. You need to be the squeaky wheel. You need to go back and say, no, I feel something still. Then they can do a mammogram. There are other rare kinds of breast cancer, lymphoma. There's a long list of these cancers that can affect the breast, but they're a very small percentage of all of them. And you can diagnose them essentially always with a small piece of tissue, no bigger than maybe 1/8 of an inch in size. Under a microscope, it looks very big, and you can see what kind of cells there are and diagnose it. Did that answer your question?
Thank you.
Any other questions? Please speak up because it's kind of loud up here with the fans behind us.
Good night, everyone. My question is, does birth control contribute to breast cancer?
Does birth control contribute to breast cancer?
I would say that a small percentage of all breast cancers may be attributed to birth control. That amount is relatively small overall, and it's dependent on the amount of time that you take it. And a lot of our fear regarding that has to do with the fact that in the past we used to use very large doses of estrogen for birth control, and now the amount of estrogen that we use is much smaller, so that overall you can say that contraception is reasonably safe. If you are again on it and you notice a lump, then you should get a mammogram. It may not necessarily be just because of the oral contraceptive.
Good evening, everyone. Oops.
Evening.
Good evening, panelists. I have a few questions for all the panelists. Let's start with the insurance first. Okay, so we have $200 benefits for wellness. What if after doing your test you realize or you're told that you have cancer? What does the insurance cover outside of that? What part do they play after you've been diagnosed?
Okay, so once you do your wellness and you utilize the wellness for your mammogram, you get tested. So you have chemotherapy coverage in place and radiotherapy coverage in place as well. So you would be required to satisfy the out-of-pocket maximum first, which is $1,000. And once that has been satisfied, then your coverage would be at 100% up to the $100,000 for the calendar year. That's on the SHIC plan. However, if your plan benefits are higher than that, then you need to double check with your insurance company to see what your limit would be there. But that is just based on the SHIC plan.
Okay, thank you very much. Let me move on to the doctor. Just to piggyback off what she was asking pertaining to birth control, right? Quite a few women here over the years have been on birth control, I'm assuming, right? And they don't have children. What's the risk? Is it higher, lower? I know you said if we don't have any children, the risk is higher. But what about birth control over, let's say, 10-year period, 15-year period?
You have to remember the difference, and I didn't address it previously, the difference between a risk factor and a cause. Okay, the risk factor is not necessarily a cause. If you already had breast cancer and you were to take an oral contraceptive, it would make it grow faster. In order to be able to tell whether it actually caused it, you have to look at tens or hundreds of thousands of women who have had it versus the ones that don't. And what you find out is the ones that have had oral contraceptives for long periods of time have a higher risk. Okay, that is, you're more likely to find women on this side having the cancer versus that side. Okay, you don't I'll go back to a mouse. Okay, in a mouse giving estrogen, unless the mouse is some special type of mouse, it's hard to cause cancer in it. Okay, so the estrogen is generally a good thing, but if you already had microscopic amounts of cancer, it's very clear that it will make it grow.
Okay, one last question for you, doctor. Natural remedies, right? Because most of us, are trying to not do chemo or, preference. We're trying to try something else because of the side effects of the chemo. Don't worry, I'm getting to you next. Okay? What do you recommend? Do you actually recommend natural herbal medicine once you've been diagnosed?
Natural remedies are good for prevention. Okay. But once a cancer forms, once the cell becomes cancerous, it's different. It is a monster. The things that will kill it, you can't kill it even with a hammer. Okay, you have to kill it with the poison or radiation, or if you know exactly why it's growing, then you can find a magic bullet pill. To take a natural remedy for breast cancer would make sense only if everything else failed. And the reason for that is that not that it might not work, you might be that one person that it works in, but how do you know which one? How do you know how much to take? How do you know what degree of benefit that you would have? So it is not something that I would advise for a couple of other reasons. Having been an oncologist for 31 years now, I've seen more women die of breast cancer who actually just, took cat's claw or, something else, powder of this kind or another. So I think that using it once you've diagnosed with breast cancer is not as good. Now, once it's all gone, okay, that there are many natural remedies that have potentially properties for prevention, to use them judiciously, okay? Because these natural remedies, almost all of them are antioxidants. Okay, and antioxidants are essentially the same as carcinogens. The only thing that is different is this much will cure you, this much will kill you. Okay, so people take, oh, I will take 18 different vitamins, and the only thing that you get is poor. Okay, I will take hundreds of supplements, and each one costs $60. Probably only thing that you'll get is what we call the negative wallet biopsy. Okay, nothing left. Okay, but you know, you have to know the difference between prevention and treatment, and then prevention again. So I'm okay with you using, you know, but if you're going to do it, the supplements are actually not as effective as the substance from which it came. Okay, so if someone tells you that okra is good for cancer, okay, it's better to eat the okra, okay, than to get it from a bottle, because you don't know whether the person that made that extract made it out of petroleum, okay, whether there's metals in it, what kind of carcinogens are in it. So just be careful with doing that.
Thank you very much. That is very informative, ladies. Miss Anika, I just want to say thank you for your openness. I was quite surprised. I mean, I knew you had it once. I didn't know you had it twice. So that was an eye-opener. And your spirit, continue. Thank you very much.
For the purposes of time, we are going to close off the question and answer session. Feel free to grab either of the panelists before they leave and have a conversation with them. At this time, we're going to be presenting to our panelists some treats. As usual, Lions Club of Tropical Gardens ensure that our panelists or our speakers are treated well. Is that correct? So can we give them another round of applause for quite an informative session? Thanks to Ms. Amica. I'm going to start with you. So every year, we normally have a breast cancer survivor treat. This year, because of COVID and limited funding, we are unable to treat our survivors. So, Ms. Amica, there will be no night at the Kimpton unless the Kimpton sponsors it. Or perhaps another sponsor would want to donate towards...
Money transfer.
Okay, I didn't say anything. I am... All right, so I have 3 pins for the ladies. And because of COVID, I will not be pinning them, and I have a tie for the doctor. Oh. The pin says, where hope grows, something blossomed. I mean, it's reflective.
I get my 3rd shot, you know, so you can pin me.
Okay, all right. So she got her 3rd shot like me, so I'll pin her. And never, never, never give up. And the last one says, over the rainbow, there is hope.
Yeah.
And Doctor's tie, which he will be wearing tomorrow on Dress Down, Dress Pink Day, is all pretty with pink and with ribbons. And did you know that Dr. Sanjay's wife is a survivor? Yes, she is.
I want to say a word. My first pink tie I bought was the day before my wife went for her surgery 11 years ago, and I took her to not the Kimpton but another place, and we spent our night there. So the pink tie brings back a lot of memories. Thank you.
Okay. We know that Miss Amica is a survivor. Are there any other survivors in the house? Woo! Come on, we give a round of applause for the survivors. Can I get one person to come and hand out a gift? How many years? 3 years. A round of applause. What's your name, ma'am? Who has the mic? Miss Bennett? Elaine? Lilith. Okay. So did you know that the mask makes you deaf? Okay. Now that we are in agreement. There's another one over here. How many years? 9 years. Woo! Anybody 14 years? I know that Miss Amica is the road runner right now. Anybody in the floor 14 years and over? Surviving. 1 year survival. Anybody?
Me too.
9 years. Whoa. 1 year. Charlene, congratulations. So our team leader, not team leader, our breast cancer chairperson, Antonita, has some gifts for those survivors here tonight. Miss Amica, I think you are already awarded one. But we have something else for you, yes.
What did I get?
Did she get a basket already?
Some money. Some money.
So
Oh, somebody took up a basket.
I love to count, and I sat here and I counted how many women there are in the room, and then I took the number that put their hands up for breast cancer, and there were, I think, 8 or 9 total
Yes.
people, and
Yes.
there are 100 and there's 112 people in the room, and the majority are women. So you can get an idea that if you're in a room this size, how many people would have.
Yes.
That's me.
So in total, we have 116 visitors, and with Lions and other persons that are here, we have about 130 persons here tonight. So I just want to say to you, survivors, continue to survive. We are here for you. Continue to thrive.
Yeah.
Thank you very much. Now, to the best part. Tonight we have full meals. Please do not run away. We have full meals for you. You've been sitting here being so patient. We want to apologize as well that we will not be distributing the vouchers here tonight. To eliminate the crowding, we will distribute the vouchers on Friday and Saturday at our Lions Den. It's right across from Mango Tree Restaurant. You will be getting a text message or a phone call to pick up your voucher. Please look out for that. Please ensure that your correct information is on the form. Ladies, I have persons who, during this period, has given us email addresses and phone numbers that are incorrect. If your information is incorrect, we cannot contact you. So to control the COVID impact, we are ensuring that the vouchers are distributed at our den. And we will have persons coming in batches based on your last name. Okay. Raffle time. Let's roll. Yes, yes, yes. Come on, the daddy man. Wake up. Woo! Our first raffle number, we're calling the last 3 digits. 198. 198. 198. Yay! Where is my cameraman? Oh, right there. Okay, 198. Please look on the ticket for me. For audit purposes, please look at the ticket. Next number is 156. 156. 156. And so she's going to model it. It's a bag. The bag is so big you can go shopping in it. Foster's no longer give you free bags. This is a free one. It's labeled Lions Club of Tropical Gardens. It's made out of cloth. Ladies and gentlemen, come on, let's win it. The next number is 174. 174. 174. She's in the back there. Okay, ready again? Oh, 156, you didn't give her a gift, does it? Can I get another lion to assist with giving out the gifts? Can I please get another lion to assist with giving out the gifts?
Give that girl a hand. She's the one that does chemotherapy at Doctor's Hospital.
Okay, okay. Whoever worker who just won a gift, that's good. All right, the next number is 123. I'm trying to move as quickly as possible because I know you are all famished and tired, right? You've been such a great audience. 123. Okay, so it's that side of the room on my right, your left, who is winning all the gifts. So we're gonna shake it up again, right? Shake it up again, Lion Tonita. Shake it up again.
Shake it up, shake it up.
And if you do not drop your ticket in it, you cannot win it. Okay, let's go again. 1, 2, 1. This is for male, or you can give it to your significant other or wear it if you choose to. Dress down, dress pink is tomorrow. 1, 2, 1. 1, 2, 1. The lady in the stripe in the back. 1, 2, 1. So I invite them to go pick up their meals. If you have been awarded a gift, your raffle ticket has already been called, please go over and collect your meal. Feel free to go over and collect your meal. Thanks to JN Money. JN Money has sponsored all awareness sessions this year. And we also want to give them a round of applause. They continue to do a marvelous job. The next raffle ticket number is 158. 158. 158. Oh, one of our survivors won again. Woo! You know, we root for our survivors. Come on, crowd, let's cheer them on. Are we that tired? Let's root for them. Next number is 171. 171. On this side, 171 going once. You have to be here to win it as well. Okay. 171. How many more gifts we have? Okay. Yes, Julie. We have 2 more items to go. I hope I see you in that tie tomorrow. Young lady, I hope I see you in that tie tomorrow. We have 2 more gifts, so let's see who is going to get it. It's 2 flashlights. Now, I've been telling the entire Cayman Islands that these lights are very good. So you know they are keyhole lights. Goes on your ring, your key ring, and when you're going into the house, you are able to see the hole. Okay? So you just turn on the light so you can find the hole. All right. The next, I'm going to get tail twisted for that. All right. The next number is 182. 182. 182. Woo! We have one more. And the last one, the very last one, 143. Yes! That lady has been so patient tonight. 143. I'm going to invite my chairperson for breast cancer awareness, Lion Tonito, to give a round of vote of thanks to our sponsors, volunteers, and survivors. Lion Tonito, the floor is yours. I'm sorry.
Good night, all. I would like to give a vote of thanks tonight. I would like to thank the panel here tonight. Jennifer, thank you very much. Amica, thank you for your story. Dr. Awasthi, thank you. And Hira, thank you very much. I want to say a big thank you to our sponsors and our supporters. And our major sponsors are REMAX, Breast Cancer Foundation, Estate of Lions, Mike Simmons, Cayman National Corporation, and JN Money. All other supporters, donors, and volunteers of LCG, Jeans Bovell, Caribbean Alliance Insurance, Caribbean Insurance Practice International Limited, Caribbean Partitions Limited, I will get the tail twister for that one, Cayman Distributors Group, Cayman Islands Leo Clubs, Compass Media, Consolidated Water, Creative Exposure, Cutting Edge Design, CUC, DMS Broadcasting, Doctors Hospital, Dr. Andrew Robinson, Dr. David Stone, Dr. Lisa Joels, Dr. Michelle Mondesur, Dr. Moses Gallo, Dr. Sanjay Aswathy, Airs, Electrical Appliances and Air Conditioning, Eclipse Hair Design and Day Spa, Fidelity Bank, Foster's Group, Guardian General Insurance, HSA Public Health and Clinic staff, Jennifer Weber, Corinne Watler, Kerry Alvarado Barantes, Kirk Market, Lisi Powell, Lions Club of Cayman Brac, Lions Club of Grand Cayman, MedLab Inc., Nurse Joy Marin, Oasis Medical Group, Ocean Med Premier Group Insurance Brokers, Radio Cayman, Sharon High, St. George's Anglican Church, Supreme Pools, Teresa Prehay, United Churches in the Cayman Islands, Veronica E. Banks, and all the walk run participants, and those who will be dressing down tomorrow for dress down, dress day pink. Thank you all. Without your support, we will be here tonight to assist you all. Thanks.
Thank you very much, Anthony. Ladies and gentlemen, we continue the fight against breast cancer. We wrap up this month with our run walk. We have been doing it virtually from the 29th to the 31st. If you have not yet registered to do a run walk, do it in your teams. Send us pictures, share it with us, like us on Facebook, and we will also tag a CUC. What CUC does is give us $5 for each tagged photograph, which is in pink. See the ladies over there to my left at the booth. Please ensure that you collect your meals. Coming up with your meals. And thank you very much for your time. Have a great night.